I'm Dr. Dan Rubin here in Scottsdale, Arizona, and this is Ad Hoc with the Doc. This is our medical show, Facebook Live, where we serve up fresh information. Basically, the content is what you ask us. In this show, the format is we pick a particular subject and we have a particular guest. I'm your host, but we have Dr. Amy Waite with us. Dr. Amy Waite and I have been working together for several years. She is a local expert in men's health, and the subject today is low testosterone. But remember, rules of Ad Hoc with the Doc are that we cannot answer anybody's individual and particular medical question. We answer general questions, so if you do have a particular question and you frame it in a general question, that's fair game, and we will go about answering it. So please write in. We will get to as many questions as we can. We'll be on for about 15 to 20 minutes, and as always, this filming can also be seen after this live show on our Facebook page, Naturopathic Specialist. So that's great. Dr. Waite, I can't wait to hear what you have to say about low testosterone, because I know it can be a real problem in our country.
Yes, thank you everybody for joining in live. Feel free to start asking questions. I'm just going to do a brief introduction. I work here at Naturopathic Specialist. My focuses are in men's health, pain management, and environmental medicine. A lot of my male patients come in discussing testosterone replacement therapy, and I think that I'm going to provide a lot of insight to that today. There are a lot of men that have low testosterone levels on their labs, but it doesn't necessarily mean you can't raise those levels naturally without doing potentially harmful hormone replacement. So feel free to start asking some questions. I'll just continue to talk until we get some.
Actually, if I may interrupt, we did have a couple people write in who said that they were going to be unable to make this broadcast live, and so we had Tom ask, basically, he said, what are the symptoms of low testosterone?
There are many symptoms of low testosterone that actually mimic a lot of other conditions, and I'll get into that. So some of the most common symptoms I see clinically are depression, weight gain. They usually gain more fat, lose more muscle. They don't have the drive anymore to kind of get up and get going. That's more of a testosterone type symptom. Low libido is a huge topic. But there's a lot of symptoms that mimic, like a lot of those symptoms also mimic hypothyroidism. So if someone has issues with their thyroid, it is going to lower their testosterone levels on the lab. But if you just give that patient testosterone, are you really correcting the underlying problem? And that's what we do as naturopathic physicians. We try to look for the underlying cause. So hopefully that answered it. Fatigue is a very common symptom of low testosterone, and as you know, there are many things that can mimic fatigue, even sleep deprivation. Sleep deprivation can also lead to low testosterone levels. So sometimes if I can just get patients sleeping, their testosterone levels will rise on their own.
We have one other question here. It says, does taking testosterone make you more aggressive? I assume this would either be the injectable or the topical or any other form of exogenous testosterone.
So we've all heard of roid rage. It can make men more aggressive, especially if they're given too much. So with the injections, most men do an injection of testosterone once every 7 to 10 days. And once you give that injection, you have a high spike of testosterone, and then it slowly dwindles off over the next 7 to 10 days. So during those first few days, they can be more aggressive, have more rage. That's usually an indication that they're taking too much.
We have one other question here, and this is again from our consortium of people that have written in. Marnie asked, are there foods that can contribute to low testosterone in the blood?
So that's a really good question. A lot of what I do is hormone balancing. So a lot of men that start gaining more weight, particularly in their belly, they are aromatizing testosterone into estrogen. And what that means is men and women have testosterone. Women just aromatize it more or convert it into estrogen. Men can do that, particularly with certain foods. Certain foods with, I can mention a few, right?
Oh, foods? Oh,
So there's a few foods that, in particular, soy is known as a phytoestrogen or plant estrogen that can increase estrogen levels in a man, so that's something that I recommend my patients avoid. There's also things called xenoestrogens or synthetic estrogens. Those are particularly found in certain chemicals in our environment and plastics. So those can also raise estrogen levels and decrease testosterone levels.
To be fair for our audience, I think what Dr. Waite and I were talking about are we have to be very careful that we don't promote or give any particular treatments to people that would seem like medical information, since we're licensed physicians here. I think that's what you're talking about. Things that you would think would be able to mention. Great. So is testosterone safe for women? We have Melissa asking.
I don't personally prescribe hormones to women. So that would be a question for another guest. We're going to have a guest every 2 weeks, and we're going to have some of our women's health specialists come on in a few weeks. So that would be a better question answered for them.
Wonderful. Okay, we have one more person, and again, audience out there, we encourage you to anything that's on your mind that we can answer in general about testosterone therapy that you've been, or testosterone in general. I didn't really mean testosterone therapy, but actually, if you have questions about testosterone therapy, that's actually a pretty big subject. Maybe we should talk about that too. But after we have one question,
okay.
I'm gonna. Angela had asked something about somebody in her family. She says, my husband is tired all the time, depressed and unmotivated to do anything. His doctor ran his labs but said everything looks fine. Is there anything else that can be done for him? Got to be careful. We can't give medical advice to a particular person. At this point, we don't necessarily know who Angela is, not asking Angela to identify herself as a patient just to maintain confidentiality. But if there's a generic way that you can answer that, do you run into cases like that?
So I do. I run into those types of cases often. What I do is I run a full panel of lab work along with a full intake. Our intakes are generally about an hour and a half. During that time, we are kind of playing detective to try to find all of the things that are contributing to, why this patient feels this way. He may or may not have low testosterone on his labs, but that's why a lot of investigative work is needed to find out all of the underlying causes contributing to why he feels this way. Usually I see hypothyroidism, sleep deprivation, high stress. A lot of things in men contribute to feeling the ways that all of the ways her husband's feeling with fatigue, depression, all of those things. There's a lot of different components that can contribute to that. Another thing is adrenal insufficiency. That's something that we also look at. High stress over a long period of time can affect the adrenal glands, and patients usually have a hard time getting out of bed. They can feel, tired all day long, particularly in the morning, but that's something that needs to be addressed before you address just testosterone. So I look for nutritional deficiencies as well. If he has a lot of nutritional deficiencies, he's going to feel tired, could feel depressed, those other things that she listed.
Okay. I'm going to make sure we're going to take a technical break for 1 second. Are you seeing the questions rolling through there? Okay, because I just wanted to make sure we weren't having a technical difficulty with questions rolling through.
It's not rolling right at the moment, but...
Okay, got it. So basically, we have a question coming in, which is are there any things natural you can do to raise testosterone? Is that, in general, not to give medical advice, but is that safe? There's probably a lot of people out there who get injectable testosterone. So I think what we should do is, as these questions are coming in, is really talk about, are there dangers associated with taking shots of testosterone? I mean, we've seen this quite a bit in the clinic.
So there's a lot of T clinics out there that are just prescribing testosterone. But a lot of my patients that come in that have been prescribed the testosterone they didn't thoroughly discuss the side effects of testosterone therapy. So I'll go through some of those. Hyperviscosity or thick blood, it increases the amount of red blood cell production, and that can lead to thick blood, leading to stroke and cardiovascular disease. Another thing that most men aren't aware of is that it can cause testicular shrinkage. Once the testicles are the primary organ responsible for producing testosterone, once those shrink, they can no longer produce testosterone on their own, and then men need testosterone injections or creams for the rest of their life. Most of them aren't explained that. Another thing I've seen is men trying to conceive or have a child. Testosterone therapy decreases sperm count. A lot of men aren't aware of that. Also, if they're not monitored properly, as I mentioned, the hyperviscosity or thick blood, it can be extremely dangerous. A lot of men aren't monitored closely to look for those lab markers to make sure they're okay, and that's when potential problems can arise. So that's why I'm very diligent about running labs every 6 weeks, every 8 weeks, just to make sure that they're okay if they are indeed on testosterone. Another question you asked is what I do to raise it naturally.
Yeah,
so I mentioned some of the things I look for as underlying causes, but I'll list off the top 5 that I see clinically. Sleep deprivation, like I already mentioned, nutritional deficiencies, hypothyroidism, adrenal insufficiencies. All of these things need to be addressed before, in my opinion, before you prescribe testosterone. They found that only 1 in 200 men over the age 65 actually cannot produce enough testosterone on their own. And the study didn't indicate whether or not they had been previously prescribed testosterone, but it's not as usually there's some other reason why they can't produce testosterone, and that can usually be addressed naturally without any harmful side effects.
So a question had come through, says, my doctor says I have low testosterone and prescribed a certain medication. I don't want to use the medication here, but it's a topical type of testosterone.
Okay.
A person, but I think we should talk about it generically, is, let's say a male is prescribed that. Is that something that they would perhaps need to stay on for the rest of their life? I know you can't make a blanket statement about every patient, but... So
it depends on how long they've been taking it. It also depends on their dosage. There's also, most doctors don't take breaks off of the testosterone with their patients. That's something that I do, just to decrease the risk of testicular shrinkage. But if he does have testicular shrinkage at this point, that is something he will have to be on for the rest of his life.
That's just a given in medicine.
Yes.
It's not particular to this patient per se.
If I were to try to wean him off and he wasn't able to produce it on his own, he would have to rely on that for the rest of his life.
Okay. You've had some great success in helping men improve testosterone levels, at the same time improving their life, how they feel, without giving shots or topicals or the actual prescription, which is wonderful because it preserves function, improves function, and certainly, doesn't have the bad side effects. It's really something I think the audience and the world and the country needs to know about, because it's fantastic work that you're doing. And I don't prescribe that. I mean, I work in the field of oncology, and there's some people who just, maybe from chemotherapy, they had, seriously decreased testicular function, or the gonadal function is just, died off from the chemotherapy and it's not recoverable. And in that case, I might prescribe that. But I just think the audience out there needs to know that, at least from my perspective, there's some serious harm that can be done at some of these low T clinics. Via some of the mechanisms that they use, there's certain ways that you can disguise a testosterone level. There's some up and downs with levels depending on when you look at it. And I just think that there needs to be real care taken, and Dr. Waite has developed a method that you even discussed in a forum when you presented at the Arizona Naturopathic Medical Association, and we're teaching other physicians. And I think it's a very naturopathic concept. It's wonderful. It's for the improvement of humanity, and I just think it needs to be shared with the world because there's people out there that can really suffer from some of these injections.
I agree. I've heard of multiple. I mean, bodybuilders are usually guys we think of when we think of men, shooting up with testosterone. But there was even a friend of mine that I went to college with that passed away. That they believe it was from his testosterone therapy. He had a heart attack at age, I think he was 37. So I just don't think people understand the risks involved, and I have to say within the last 20 years there's been a really steep decline in testosterone levels amongst men, and I think that's why a lot of testosterone clinics have been popping up lately. I mean, testosterone's big business, but I agree with you. I think it needs to be made aware that testosterone can be extremely dangerous.
So because there's a lot of low T clinics popping up, is this like a new phenomenon? Like all of a sudden in 2015, 2016, like males and or females all of a sudden have low testosterone? It's like we didn't have a genomic switch. Mm-hmm. Maybe we had an epigenetic switch, but could it be our environment? And if we just remove certain things from the environment, like you've been saying, could those normal functions be sort of emancipated so they can produce it?
There are a lot of chemicals out there that have the xenoestrogens in them that I spoke about earlier, and that's one thing that all of us do with our patients is we discuss the chemicals in our environment that, we're never going to be able to control all of the chemicals that we're exposed to, but at least decreasing the amount by a significant level really can benefit someone's health. And I know that you talk to your patients with cancer prevention, but even just decreasing those estrogen levels just by addressing, let's say, plastics or some of the other chemicals in our environment can raise testosterone levels. And I just believe that those things need to be addressed before you prescribe or before a patient starts taking testosterone.
I mean, I know us two and the other doctors that we work with here, I mean, we take hormones very seriously. And if you're going to prescribe a hormone, it can't be just, I don't want to say frivolous, but there's other things to also look at. And I think that's really your forte, and that it's a wonderful thing. And part of the reason we wanted to talk about this is we're concerned about some of the prescriptions out there. We're not picking on anything in particular. It's just that there's some serious consequences from testosterone therapies. You can say some lead to death. I mean, people die from things, all the time.
Right.
Obviously, can't just pick. But there is a real reason that people could die from too much testosterone. Plus, there's probably a physiological rate at which somebody who wasn't living in an environmentally toxic place, where as the male ages, the gonadal function decreases over time, and so we know our labs give us a range of normals, right? And so, do you see that men coming to see you who are on shots or creams of testosterone are super physiological, like higher above that range? And if you do, is that, or being in the sort of higher normal ranges, is that where you think some of those side effects can occur?
So yes, I do. If I see someone that's way too high, of course, I bring them down, and then eventually, I mean, the 95% of my patients, I eventually wean them off completely.
It's amazing.
But if a lot of men I see have really high levels of testosterone and they still feel awful. They're still depressed. They still have fatigue. A lot of them too, it's funny, their aromatization or converting testosterone into estrogen is not being monitored properly, and these men are growing breast tissue, they're growing large bellies, they're wondering why they're gaining fat or gaining weight instead of gaining muscle like you're supposed to on testosterone. That's what their doctor told them. The aromatization or that conversion from testosterone into estrogen is not being monitored closely. So, I mean, it's almost like they're being injected with estrogen. If it's not monitored closely, it's converting. And so you really, if anyone is on testosterone, you need to get the pathway looked at or the labs ran frequently to make sure that everything's okay.
That's an important point, because I see that in our practice too, that hormones are being given, but labs aren't being run to monitor them maybe once a year, and I'm not okay with that.
I had a patient on estrogen on testosterone for 5 years, and his estrogen levels were never ran. They were never looked at. Yeah. And I mean, once I ran them, they were off the charts, almost as high as a woman. I mean, they were ridiculously high.
That's problematic.
And it's really sad.
It's problematic. All right. What's the take-home message here to the audience out there about low T in America, everything? What are a few, maybe 3 to 5 pointers for summary?
Low testosterone affects many men way more frequently than it used to, but there are a lot of underlying causes that can be addressed rather easily. The take-home message today, I think, is look for those underlying causes before going down the testosterone road. Once you go down that road, if your testicles shrink, it could be irreversible. If you grow breast tissue because you're converting it into estrogen, that could be irreversible. You may need surgery, and it's embarrassing. But make sure that if you go down that road, that you go and see someone that's really qualified.
Great. It's been highly informative. It's been great talking about this in this forum, and thanks everyone.
Thank you.